we have to remember who we are.
Thank you so much for joining us on Health and Wellness. I'm your host, Rosen Green. Inflammation in the body is a normal and healthy response to injury or attack by germs. We can see it, feel it, and measure it as local heat, redness, swelling, and pain. This is the body's way of getting more nourishment and more immune activity into an area that needs to fend off infection and heal. But inflammation isn't always helpful. It also has great destructive potential, which we see when the immune system mistakenly targets the body's own tissues in autoimmune diseases like rheumatoid arthritis and many others. With us on today's show is our resident doctor, Dr. Robert Gucciardo, and he's from the Gucciardo Specific Chiropractic and Natural Health Center. And today we're going to talk about inflammation and the causes of inflammation. What exactly is inflammation? So let's start up there. What exactly is inflammation?
Okay. Well, you said it well just before. Inflammation, there's actually two types of inflammation, and you actually described them both. The first definition you gave was for acute inflammation.
Okay.
Acute inflammation is, you're out on the street and you twist an ankle and you hurt it, you injure it, it swells.
Okay.
It gets a little swollen. Like you said, there's blood flow into the area, nourishment, white blood cells, all these things begin to happen. And usually after a week or so, everything starts to pan down, and over the next few weeks, it starts to heal, right? And does its thing. You can also get an acute inflammation from something maybe you ate, like a bug or some type of enterovirus.
Yeah?
Yeah, from foods, like a food poisoning, and that's an acute inflammation.
Right.
And it's usually gone relatively quick. But we also have what's called a chronic inflammatory response. That's when that acute inflammation goes awry. It doesn't happen properly, like you said.
Correct.
And there's things that will hinder the body from not healing properly.
Right.
And that we'll get into in a little bit. But the chronic inflammatory response is a sustained immune response.
Right.
Things swell. Now, it doesn't always have to be just an injury to a knee. We can have inflammation in organs. We can have inflammation of the heart, the pancreas, the intestinal tract, small intestine, large intestine. Yeah. So you can have inflammation pretty much anywhere in the body. Yeah.
And how can we have inflammation in terms of terms of the organs, though?
Well, when we talk about inflammation on a sprained ankle or an injury like that, that's more of a generalized swelling.
Right.
But when we think about an organ is just a cluster of cells.
Oh, wow.
And we're talking about inflammation more on the cellular level. See, each cell has a protective mechanism, and there's information in there, and that's what keeps those organs working right, or those muscles and tissues working right. But when that becomes disrupted, okay, that's at the cellular level. There's a lot more that goes on in there. There's a whole cascade of systems that take place to start to heal that.
Wow.
And we need certain things in place to heal that as well. Yeah.
And in terms of the causes, though, because a lot of persons, they say, okay, we know that acute, in terms of the sprain, some persons say sprains, when you get a sprain, it don't never go away.
Again,
how true is that?
It is true to some degree, because if it wasn't healed properly, if the proper therapy wasn't done, or mechanisms to allow it to heal, that can be an issue. And if certain nutrients aren't in there as well from our food, or too many of the wrong nutrients, can hinder the healing process as well. So we can talk about that as well. Yeah.
Wow.
But let's talk about, that's easy to talk about a sprain. But how would someone know if they have inflammation in their body in other ways, right? So there's some things we might consider or look at. Some of them would be, sometimes people are a little slow in getting up in the morning, or it takes them a long while to get ready. Or when they get up in the morning, they're achy, stiff, not moving as quickly as they should. Maybe they always have frequent aches and pains. That's a sign of chronic inflammation.
Oh, wow.
Maybe they're overweight and they can't get rid of that extra weight, and they find it really hard to do that. So there's many different signs. Bloating. right after a meal or shortly thereafter. Absolutely. There's an inflammatory response going on in the stomach, the intestines, somewhere in there. That's actually a sign of an underlying inflammation. Yeah.
Oh, wow, that's interesting, because sometimes persons, they like finish eating, they're like, oh, or even some persons who don't eat that much, they get up and they're bloated, they're like, oh my gosh, I'm so bloated. But for me, and I'm sure many other viewers, they wouldn't think that that would be inflammation, though.
Well, just like an ankle can swell, so can the intestinal tract and the abdominal cavity.
Right.
It'll swell. That's swelling, inflammation.
Right.
There it is.
Wow, wow. And let's talk about some of the illnesses that
well, if we look at inflammation, one thing I want to clear up when we talk about other illnesses is inflammation is not the cause of the illness. If you go online and you pop in, inflammation, what causes it, and what happens, you'll see that most diseases, they say the cause is inflammation.
Right.
Now, that's true to some respects.
Okay.
But what's causing the inflammation is the actual true cause. Wow. So if we have a chronic inflammation, I mean, you think about it, diabetes is a sign of chronic inflammation.
Right.
It's an inflammation of the pancreas. It's not working the way it should. You can have heartburn. That's a sign of chronic inflammation.
Right.
We can have multiple sclerosis, which is a neurologic degeneration. It's a chronic inflammatory response in the nerve system. Parkinson's. Yeah.
Oh, wow.
Alzheimer's. So all these different situations, all these different diseases are potential precursor to that is the chronic inflammation.
Right.
Yeah.
Oh, wow.
Yeah.
And as it relates to, because as you said, inflammation is not the cause, but there's some underlying issue that causes an inflammation to occur, per se. So in terms of, let's look at cancer. I'm sure during my research, a lot of persons say inflammation is the cause of certain cancers.
Correct. Again, we have to look back and say what's causing that inflammation.
Right.
And we'll get to that in a moment when we talk about that.
Right.
But if we talk about cancer, yes, it's a chronic inflammatory state.
Right.
Now, when inflammation goes for a long or extended period of time, there's a few different pathways that it can take. One would be an autoimmune condition.
Okay.
Autoimmune conditions such as a thyroid issue, Hashimoto's thyroiditis, something of that nature.
Right.
So that's one way when there's a chronic inflammatory state in the body that it can show up. Another way would be what's called apoptosis. It's a very big word.
Yes, what's that?
But basically all it means is cell death. The cells are becoming destroyed. Wow. It's almost like they're committing suicide because they're breaking down. But that happens when we have a situation, another big word, it's called nuclear factor kappa beta. Nuclear factor kappa beta.
Okay.
What that is it's an enzyme that's released, and that's how our DNA expresses itself. It's called transcription. Right. So our DNA sends messages to our RNA, and things start to happen, but how it expresses itself in a chronic inflammatory state is actually damaging, because what happens is the cell starts to break down. It becomes, and as it breaks down, the ones around it will begin to break down with it. Wow. So we'll have this chronic inflammatory state causing a breakdown of all these cells. That's cancer. That's a tumor. That's what that becomes, or spreading.
Okay.
Yeah, it breaks down.
Okay.
And then we have just, situation where the cells just become dysregulated. They might not work the way they should, maybe only 50% of their normal function. Right. So there's different scenarios that happen. But yes, cancer, the underlying stimulating factor is the inflammatory response. But again, we have to understand what is causing that inflammation, because each case is different. Right. Yeah.
That's interesting, because as it relates to, as we're talking about in terms of the underlying cause of inflammation, is not just, but the explanation you give about cancer is so interesting, because a lot of persons that goes to their physician, they're diagnosed with cancer, but they don't fully understand in terms of the process and what causes it. Yeah. They go like, what could they have done differently? Exactly. So it's not explained like that. And I'm sure a lot of viewers watching say it's not explained to them like that. It's explained to them in a different format, in terms of they're just being diagnosed with an illness without even fully understanding the first step. And the first thing that they'll recommend is chemo.
Yes.
Without even thinking about alternative stuff. But we'll talk about that in our next episode. But as it relates to other illnesses, for example, rheumatoid arthritis. That's one of the main, as it relates to autoimmune disease, as they classify it as autoimmune disease.
Well, the body is attacking itself.
Yes,
That's exactly what's happening. So it's tissue destruction. An autoimmune condition is just tissue destruction. The body keeps attacking itself, and in the joints there's synovial linings and all these different protective things so we can move our joints and not have pain. And what's happening is the body is just attacking it, breaking it down. So the cartilage
why does that though?
Again, you got to find the reason for the inflammation. Let's talk about that, because there could be a number of different reasons why someone would have inflammation. There's different stressors. But before I do that, I want to give you an example. I want you to think about this. We have a lot of things in our environment that can cause stress. Okay? There are chemicals, herbicides, pesticides, you name it, all these different things out there. We have metals in our mouth, in our foods, in many different things that we are constantly absorbing into our body. And our body has to fight that. That's an immune response. Every moment, every minute, every second, your body is fighting something and trying to handle that. So stress is a good thing to some degree, but stress is one of the triggers of inflammation. And we'll get to that in a moment. But I want you to think about this. So we talked about metals. So let's say you're a mom. Well, you're a woman, okay? And you become pregnant. And you already have certain chemicals or metals in your body, in your tissues. Guess what? That's transferred to the baby. So that baby is already starting off with metals and chemicals in their tissue. Lead, for example, is stored in the bones. Okay? So what happens to moms as they're pregnant, they start to lose bone. Why? Because the baby needs all that bone structure for their development. So guess what comes through the placenta with all that bone tissue? The lead and other metals and things like that, right? So now here you have this newborn baby, starts out with no fighting shot. They got metals, they got chemicals, they got all this stuff there, right? And then the first thing they do is they give them a vaccination right away. So they add more inflammation because they're stimulating the immune response to allow them to fight off or be protected against these diseases, right? So, it's like an onslaught. And then they start eating, and maybe they're eating the wrong foods, and there's more inflammatory response there, right? So it just continues on. And now because of all the inflammation that's in their body, they might need certain medicines to handle that, which adds more stress to the body. So, we have this younger generation coming up that's so chemically, beat up.
It's dangerous. And as you talk about in terms of immunization and getting all these... because it's a touch of the bacteria that they give to the body, right, in terms of immunization.
Well, there is, because they're trying to stimulate an immune response in the body, right, so that now the body will be protected. And there's two different type of responses that happen. There's an innate immune response, and then there's a fixed immune response, but we're not going to get into that. I mean, there's a lot of good information out there on that, and you just have to inform yourself about vaccines. There's a lot of good organizations, too. The National Vaccine Information Center, they have a lot of good information just to educate you, because I think, like you said before, when someone goes to the cancer doctor and they're just told they have cancer, there's still no education.
There isn't.
Where did it come from? What steps could I have taken to at least try to prevent that, right? Well, this is that type of organization. They're there to give you information about the pros and cons of those things. But so getting back to the stressors, so what are these main stressors? So you have chemicals. You have metals, okay? We have foods. People have certain food sensitivities that can cause inflammation in the body, right? We'll have infections, bacteria, viruses, parasites, all these different things that can cause inflammation in the body. And then we have stress, right? Stress can cause inflammation.
Stress can cause inflammation. I learned that because coming by the office, you learn so many different things in terms of things that you're like, oh my God, kind of effect. I can't believe. Because you've gone through so many different things and you're thinking that it's something else.
Right.
Explain to our viewers in terms of stress, how stress can can cause?
Well, there's stress in many different factors, right? We have a physical stress, which can be from an injury, like we talked about before, or maybe someone who is repetitively doing things out there, like a construction worker.
Right.
You know, he's repetitively doing the same movements. That's a stress on the body over time, repetitive stress injuries.
Right.
We have mental stress. We have emotional stress, and we have spiritual stress. We have all these things that can add. Now, we'll talk about it later, but there's ways that we can, learn to balance our life, right? And mix it up so that we're all not just overburdened in one way. But if someone does have continual stress, whether it be physical, emotion, spiritual, however, the body responds to it the same way. It's an immune response.
Right.
And the body has to do something, and if that stress keeps coming and keeps coming and keeps coming, and it's not relenting, and there's no breaks, we're going to have a problem. That's a chronic inflammatory response, which can lead to the conditions we talked about.
Oh, wow.
Yeah.
Wow.
So stress is a major thing, and people need to learn how to order their lives, because we're just kind of running with things, and we're not really stopping to think.
That is so true.
Yeah.
That is so true.
Yeah.
That is so true. I want to ask you too, in terms, because I know you've met up on a lot of situations in your office where you're like, I'm wow at even some of the condition and the stories that you hear about, and I want you to share with us in terms of how you deal with it. Have there been a situation like, wow, it's a lot, one person dealing with so many different things that causes inflammation in the body, and how you deal with it?
Well, when we work with patients, we have to be in tune to what their lifestyle is like. Right? Because if I just say, oh, well, we'll adjust your spine and, you'll feel better, and they might feel better temporarily, but there might be triggers in their life that are chronically causing that stress and they're causing that, to be needed to be adjusted over and over again. Or, you come in for nutrition and we work with you nutritionally, there might be an emotional stress that's really burdening you. And if I don't at least have an idea about that, I can't know how to work with you or advise you, because I might say, well, you might need to go get some counseling or seek some help for that.
So true.
Because that's part of it, right? There's no one thing. I was telling my daughter one day, and we were sitting and talking about, what a balanced life is, and I was telling her that, God's in the center, and then you have all these spokes on the wheel, right? And all those different parts, how we eat, how we communicate with others, how we do at work, how we do at church, how we do with that. So like all these things, but God has to be in the center of that, right? And we have to continually look back to that. But if we lose sight of those things, we become stressed. So maybe one of those spokes, is out. Maybe we're not in a good way between God and that. And what happens is that wheel starts to wobble a little bit. And then if another spoke kind of gets out of balance, the wheel's going to wobble a little bit more. And before you know, we're spinning out of control, and we're kind of wobbling all over the place. We got to go fine tune those. So when a patient comes in, we need to look at all those spokes. We need to see what's really going on to figure out how to get them balanced or get them the help that they need if it's something that we can't help them with.
Wow. Interesting. Interesting. Because why I wanted you to explain that, because I found that a lot of persons that come to your practice, not just feeling better, but the mentality change, and even I can speak for myself, change, because that too I see you put focus on in terms of not just giving you something to take, but just the mental state of thinking and knowing what to do and being informed.
Absolutely.
Help you in terms of to move along, to help better your life, not just to get a quick fix.
That's right.
That's something that I've learned in terms of not to just get a quick fix and you're good for the moment, like a high.
Right.
And then a couple of days after, you're like, it's a crash kind of thing.
Well, if you're taking if you have inflammation and we identify that, you can take a Tylenol and feel a temporary, reprieve and feel a little better, but it's not going to be long term.
No, it's not.
We're looking to change lifestyles and make long-term changes.
Right.
Anyone can change short-term.
Right.
It takes perseverance and it takes courage to keep going.
Right.
And make real changes and not go back and repeat those mistakes.
And in terms of some of the persons watching and they're saying, I have MS, is that something that is caused from inflammation, or is a contributing factor that arrive from inflammation that create that condition.
Yeah, it is. It's definitely an inflammatory response in the body, in the nerve system. You know, there's a lot of different theories out there. I don't know if you're familiar with Lyme disease, but a lot of people are now saying that people who have MS actually have underlying possible Lyme. You know, it could be part of it. But again, that's an infection. That's all inflammatory. So we have to find out what that is. In one person, it might be that they have metals that are affecting and causing that inflammation. In someone else, it might be Lyme. In someone else, it could be something completely different. It could just be a simple thing like milk or wheat, you know, that could be causing a stress.
Wow.
Yeah.
That's interesting, because there's your food.
Yeah.
That you eat can be something that is affecting you so seriously, because a lot of persons, they eat into how I feel today instead of what this will do to my body and what this. And there's also something else that you pointed out that I want to bring across to our viewers, is that like certain things that you eat is not agreeing with your body, so your body starts to reject it.
Absolutely. That's inflammation.
Wow.
Yeah. Yeah.
That's an interesting piece, because I'm from the Caribbean. And even all those persons who are watching yourself from the Caribbean, our diet is a tricky one, a very tricky one in terms of something that we eat, and we eat a large portion. And you teach us in terms of how to pull this away, what to add back to it for us to not feeling like a withdrawal from it, in terms of like, oh my God, I need it. And one of the main things too is rice. I know a lot of it nodded yes. Can, especially starchy food, can that contribute to inflammation?
Absolutely it can. That puts us on the whole topic of sugar, right? A lot of people think, you know, that they can eat a lot of rice and do these different things, and it's okay. But culturally, if you look back, a lot of people, they didn't use a lot of it. My gosh, you go into some of these places, they give you takeout, and there's a pile of rice and like 2 little pieces of chicken and like a couple of scattered vegetables. You know, they're filling you up on that. That's not healthy. That's not a healthy situation.
That is true.
But we have to take it from this respect when we think about sugars, right? People don't think of rice as a sugar. People don't think of potatoes as a sugar. People don't think of, you know, bread as a sugar. But it is. It is. It breaks down in the body, and it breaks down into its little different sugar molecules, and then the body uses it, right? So if we're having sugary things already, and then we add the rice and the pasta and the bread and all those things on top of it, and the potatoes, we're adding more sugar. Wow. I was looking at something the other day. It says on average, most Americans will consume upwards of about almost 300 grams of carbohydrates a day. Half of that being from sugars, the other half being from, you know, like the rice, the pasta, and the other things. But then the sugar is coming from like soft drinks and other things. Wow. And that's crazy.
Yes.
What I try to teach my patients, you know, as they're eating, because that does cause inflammation in the body, sugar will actually interfere with the absorption of calcium and magnesium, if you think about that. That's major, because you need those things for building bone and different things. And all, I mean, calcium's in a lot of different things, but it's going to interfere with that. That's a problem. The sugar molecule will actually interfere and bind to the vitamin C receptors in the body. So you can have all the vitamin C you want from a big old orange, but because of all the sugar that's linked with it, you might not get the C that you need. So we have to look at the amount of sugar we're consuming. The standard American diet is very high in sugar. A lot of people are pushing low fat as well. You know, it's interesting, the low fat thing. I was watching as, you know, we were preparing for, you know, doing an inflammation, you know, topic. You know, I start looking at all the different people and what are they saying about inflammation and different things. And I watched something on Dr. Oz. It was a little like 4-minute clip, and he was doing something, and I'm actually going to do this study because I have to now just to prove this. Okay. He did a study on inflammation in the body. One of the markers that we can use is C-reactive protein. C-reactive protein tells us about inflammation in the body. It doesn't tell us specifically where it's coming from, but that it is coming from somewhere. And one of the things he was saying is that A healthy diet in good fats will keep those things down, triglycerides, C-reactive protein and all that, but a diet that's high in bad fats and all that will raise it. So he did this study on his show. He took a woman who has a really good diet, fish, vegetables, fruit, all that, and they drew blood from her, and they tested the C-reactive protein, they looked at the quality of the blood and everything, and they had her on the show, and they had her, she ate a meal, high in fat, and all this different stuff, and then they drew blood an hour later and did a comparison on the two. And they said that her triglycerides skyrocketed. Her C-reactive protein was like 10 times the amount or some silly thing like that. And then they showed the blood, and it looked like glue.
Wow.
It looked like really thick and like a gel almost. And but the picture they were showing of the food she was eating, because they gave her all these, a whole bunch of calories, way more than anyone should eat. But, you know, they had pictures of burgers and donuts and all these different things. So the thing that I was surprised at is that, and he mentioned saturated fats. Saturated fat has been demonized, and he actually added to that, which I was surprised, because he said that too much saturated fat and all these poor fats are no good. That's what caused it. But I got to tell you, when I think about that, I'm going to actually do that for myself. I'm going to have my blood drawn and then eat. But when I do that, I'm not going to have, you know, the bun. I'm not going to have the donuts. I'm going to have a lot of high-fat meats and different things and see what that looks like with vegetables. But the reason why I was kind of upset by that is we talked about inflammation at the cell level. Every cell membrane needs saturated fat. It's what gives it the tensile strength to protect the cell inside. So if we don't have that saturated fat, we're now breaking down, leaving that wall open to being broken down and having more inflammation in there. So we need saturated fat. Granted, we shouldn't be eating, you know, steaks 3 times a day and doing things like that, but we need that saturated fat. So I was upset by that. But low fat also, the reason why he said that, low fat usually means added salt and added sugar. If you look at any label, that's what's going on. And that adds to the inflammatory response, too, in the body.
Wow, fantastic. Oh, my, I know. It's a lot of information that you have to get, but guess what? We're going to do a part 2 of this segment, of this about information, and we're going to give you even more information on it. And also, we're going to come back and talk about in terms of the solution. There are solutions. You can prevent inflammation, and you can also what? Heal from inflammation, correct? So stay with us. We're going to wrap up this segment. Thank you so much for joining us on this first part 1 of part 2 segment of Health and Wellness. Stay with us. Join us next time for part 2. Thank you so much to our viewers for staying tuned to Health and Wellness. On behalf of the entire production team, I want to wish you good health and wellness.